What could you achieve if I had given you the questions? Yeah. Our next participant is Dr. Shalin Soni. Dr. Shalin Soni, again, a family physician with interests in cosmetology, and you've not written about your passions or interests.
I travel a lot.
You travel a lot
Once
on
a year,
work.
we take a huge trip for 15-20 days.
When he says we take, that means he's going with many other doctors. Yeah?
No, it's a family trip. Family trip.
Okay.
About 18-20 people.
Wow.
And we hire a bus, we have kitchen with us, and it's a grand trip.
Kitchen with you, huh?
Yeah.
Okay.
No outside food.
Typical Guju.
Yeah.
What is the last place you went to?
We did temple tour of Tamil Nadu.
Tamil Nadu. Okay.
15 days trip.
Okay.
We started from a holiday resort. So that's how we mix it up with resort, with hill station. We went to Kodaikanal also while coming back.
With pilgrimage.
With pilgrimage.
With everything, yeah. Wow. And you are not, meaning your family is jewelry, into jewelry? Soni?
No. We are medicine people.
You are all medicine people. Yeah. Okay. Okay. So I hope that you do very well in your chosen topic, which is diabetes, pharmacotherapy of diabetes, and
metabolic syndrome.
Metabolic syndrome, he added because Devesh was already doing diabetes pharmacotherapy, and he said slightly different from what he's doing. But yeah, most of your questions are on diabetes pharmacotherapy because that is what is important to us in terms of pharmacotherapy. Your timer starts now. True or false? Pioglitazone is more likely to cause weight gain if combined with insulin.
True.
Correct. If a patient of diabetes has albuminuria, which of the two now require tighter control? High blood pressure or high LDL cholesterol?
High blood pressure.
Is correct. Which causes greater weight loss? Exenatide or sitagliptin?
Exenatide.
Correct. Should aspirin be withdrawn if a diabetes patient with proliferative retinopathy develops retinal hemorrhages? Yes or no?
True.
Incorrect. Name a complication of SGLT2 inhibitors that is more common in type 1 diabetics than in type 2 diabetics.
Hypoglycemia.
Incorrect. Significant GI side effects are experienced with which group of oral antidiabetics other than metformin? Significant GI side effects. Which group?
AGI.
Is correct. One of the 5 criteria defining the metabolic syndrome is an LDL cholesterol level of 160. True or false?
True.
Incorrect. Which of the two has more rapid onset of action in lowering blood sugar? Pioglitazone or metformin? Rapid onset.
Metformin.
Is correct. What is the commonest side effect of SGLT2 inhibitors in type 2 diabetes? Commonest side effect.
Genital infection.
Is correct. Which oral drug used for pituitary disease is now approved for type 2 diabetes?
Bromocriptine.
Is correct. In August 2015, the US FDA issued a warning about severe arthralgias due to which anti-diabetic drug group? Arthralgias.
Pass.
Fludrocortisone, a mineralocorticoid, is occasionally used to treat which complication of diabetes?
Pass.
Of the 3 long-acting insulin analogues, detamir, glargine and degludec, which has the longest duration of action?
Degludec.
Is correct. Multiple combination formulations of diabetes drugs have recently been banned. Which one drug is a common ingredient?
Pioglitazone.
Correct. Which gliptin has a predominantly fecal route of excretion? Which gliptin has a predominantly fecal route of excretion?
Lina.
Is correct. In August 2015, USA FDA issued a warning about severe arthralgias due to which anti-diabetic group? Take a guess.
Other one?
Fludrocortisone, a mineralocorticoid, is occasionally used to treat which complication of diabetes?
Guess would be for previous question. Guess would be gliptin.
Is correct. And fludrocortisone is a mineralocorticoid used for which complication?
Addison's.
Incorrect. So we'll take the questions which he could not answer. How many? What is the score? 11 out of 15. Okay, your questions. Should aspirin be withdrawn if a patient develops retinal hemorrhage? Should not be withdrawn. Complication of SGLT2 inhibitor that is more common in type 1 is diabetic ketoacidosis, and LDL cholesterol is not one of the criteria of metabolic syndrome at all, and fludrocortisone use postural hypotension due to diabetic autonomic neuropathy. And the last question that you could not answer was in August 2000. He did answer that.
4. Yeah.
Is that all? Yeah. Okay. Wonderful performance. And Soni, your second set, we will start the timer now. Should aspirin be routinely stopped before cataract surgery?
No.
Correct. If a thyroid patient is put on first line AKT, is the dose requirement of thyroxine more likely to increase or decrease on AKT?
Decrease.
Incorrect. If a lactating mother has active pulmonary tuberculosis, what should be given to the baby first? INH prophylaxis or BCG vaccine?
BCG vaccine.
Incorrect. Which one of these three is treated with antiviral drugs? Acute hepatitis A, acute hepatitis B, acute hepatitis C?
B.
Incorrect. How many doses of HPV vaccine are recommended in a 10-year-old girl?
2.
Correct. In children up to 2 years of age, a common X-ray chest shadow is mistaken for a mediastinal mass. What is this physiologic innocent structure in a 2-year-old child?
Thymus.
Correct. Ursodeoxycholic acid in a dose of 10 mg per kg per day for 2 years would be a possible therapeutic regimen.
Gallstone.
Is correct. In relation to altitude illness, if HAPE stands for high altitude pulmonary edema, what does HACE stand for?
High altitude cerebral.
Is correct. What is the maximum duration of efficacy of Mirena, a contraceptive which contains
3 months.
Incorrect.
3.
Penicillins and macrolides are generally considered safe in pregnancy. Which macrolide is a category C drug and not used in pregnancy? Which macrolide?
Erythromycin.
You said Clarithromycin.
Clarithromycin
is correct. Most ovarian cancers arise from the surface and hence metastasize fast locally. Which pelvic cancer also arises on the surface and therefore causes less minimal local symptoms in a male? Pelvic cancer in a male which arises on the surface and hence causes less local symptoms.
Testicular tumor.
Is incorrect. The commonest gynecologic symptom is menorrhagia. Name the commonest cause of menorrhagia. It is an idiopathic disorder and a diagnosis of exclusion. Commonest cause of menorrhagia.
Fibroids.
Incorrect. According to Courvoisier's law, in a patient of obstructive jaundice, if the gallbladder is palpable, the cause of obstruction is what? In Courvoisier's law, obstructive jaundice.
CBD stone.
Incorrect. Normal semen has 3 requirements as per WHO. Volume greater than 2 ml, sperm concentration greater than 20 million, and a forward motility of sperm more than what percent?
50%.
Is correct. We'll finish this. This is a true or false question. The earlier you start an antibiotic in enteric fever, the greater is the incidence of relapse. True or false?
False.
It is true. Thank you, Dr. Shalin. Your score is? 18. Total 18. Answer was incorrect. Thank you. We'll just do the questions that Mirena, what is the duration of effect for contraception? 5 years. 5 years. Copper based are 10 years. Mirena is a hormone based contraception. the dose of thyroxine requirement in AKT patients increases because rifampicin interferes, increases the metabolism of thyroxine. Hepatitis C is the acute hepatitis which is treated with antiviral drugs. Gallstones are treated, he said that correctly. Prostate is the cancer, not testes, which arises on the surface and hence causes less symptoms of LUTS especially. Which is the commonest cause of menorrhagia? DUB, dysfunctional uterine bleeding, which is a diagnosis of exclusion. And according to Courvoisier's law, which malignancy? Pancreatic malignancy or pancreatic tumors will cause gallbladder to be palpable.